We have over 5.
Over 5. Wow, we're doing really well, aren't we?
And we are now in recording.
Okay. All right. So let's call to order the Clark County Veterans Advisory Board this Thursday afternoon, April 8th, 2021 at 2 o'clock. So if everybody would, Sam, if you would put the flag up for us, please. And then, all right. We'll all join in the Pledge of Allegiance. So, ready? I pledge allegiance
to the flag,
to the flag
United States
of America,
and to the
and
republic,
to the republic for which it stands, one nation, under God,
indivisible,
with liberty and justice for all. All right, thank you. All right, is there anybody here willing to give the invocation for us, please?
I will.
I'm sorry.
Shannon will.
Shannon, great. Thank you, Shannon.
Welcome. Father God, we just thank you for this beautiful day. We thank you for the camaraderie that we have here. And we just ask for your presence during this meeting and let your will be done. We ask for the people that were not able to make it, that you would bless them, Lord, and bless the families of the veterans that have passed away. In Jesus' name we pray. Amen.
Thanks again, Shannon. Appreciate that. All right, Bruce, you want to do your roll call?
Yes, Madam Chair. Just a moment or two while I pull everything up. Oops.
Okay.
Okay. Roll call of the post. Post 48. Morris Giesler. Steve Sledgers. American Legion Post 14. No rep. American Legion Post 44. Duran Wirtz. John Rose. American Legion Post 168. No rep. American Legion Post 176. Michael Gibson.
Here.
Les Schreiber.
Here.
American Veterans Post 6. John Lovejoy. Vanis Pratt. Disabled American Veterans Chapter 4. Board Secretary Bruce Moss here. Korean War Association 321. No rep. Marine Corps League 826. Primary Steve Sledgers.
Excused.
John Stoffel. VFW Post 4278.
Here.
Shannon Roberts. Dana Difford. VFW Post, Dana's excused. VFW Post 7824. Board Vice Chair Michael Harding.
Excused.
Mike's excused. VFW Post 12028. No rep. Should be David Daly. Vietnam Veterans 512. Greg Whitsitt. Nick Herbert. Members at large. Board Chair Kelly Jones.
Here.
Jim Jensen.
Here.
Michael Langsdorf. Jim Jensen's here. Michael Langsdorf. Kevin Lawson. Brian McGillis.
Excused.
Oh, McGillis is here.
Tanya Wark. Tanya's here. Clark County Representative Samantha Whitley.
Here.
The Assistant Senator Judy Russell. Sharon Tyre.
Here, we're both here.
All right. Is there anybody else who has joined us today? Please state your name for the record.
Mallory Huerta, DVOP, Vancouver WorkSource.
Okay.
Leslie, Transition Projects, Portland.
Anybody else?
I'm here, Liz Estabrookes. I'm here from DC.
Anyone else, please? All right, we have 5 guests with us today. Thank you for joining us. And there you go, Madam Chair. That's our roll call.
All right, thanks, Bruce. All right, everybody received the March 11th meeting minutes. Are there any issues, concerns, additions, changes, whatever? If not, I'll take a motion to approve.
Mike
Madam
Gibson
Chair, I voice
to approve.
All right, is there a second? I heard a lot of motion to approve. I just need one person to say I second it.
Second.
All right, there we go. All right, motion approved and minutes are approved. Okay, moving right along, that brings us right to Elizabeth Estabrook. She's actually with the Center for Women Veterans, the VA in DC. She previously worked down here where we dragon boated together. So I'm excited to have her with us because we've not done. Okay, first of all, everybody who's not on mute and not speaking, please put your computer or your phone on mute. Please, as there's a lot of feedback here. Okay, so without further ado, let's let Liz talk about women veterans issues, which we have not had a lot of on this board. So welcome, Liz. I'm thankful that you could join us today. I know you're very busy up there, so welcome. Let us know what's going on.
Thanks, Kelly. Hi, everyone. Thank you for having me today. I'm happy to be here. So I do have a little PowerPoint that I'm going to share, hopefully, if I can do it right. Sometimes I'm not so good at that stuff as I think I am. So let me see if I can make this work. Maybe. Uh-oh. Is that happening? Can you see it? Uh-oh.
Yes.
I don't see it.
I can see it on my end.
Okay, so now you can see the PowerPoint?
I can, yes.
Okay, good. All right, so let's make this happen. Okay, so what I'm just going to talk today, how long do I have? Just 10, 15 minutes? Yeah? Can you hear me?
You know what? As long as whatever you need to do.
Okay, okay.
I mean,
So-
you know, as
so
long as
this-
it's not 2 hours.
Oh, no. God, no.
I know you can talk about this for days, though.
I can, but you know, it's after 5. So, so the Center for Women Veterans was actually established by Congress in 1994, and it was established because it was recognized that women veterans simply were not getting the services, equitable care that men were getting, even though we'd been serving in the military since the American Revolution. So we have certain mandates under public law that have been there since 1994. Our budget is established by Congress, everything about what we do. So we have our mission, we serve in the office of the secretary. And we really, what we do is we work with the secretary and leadership in VA in DC to make sure that policy is inclusive of women, and we look at you know, we'll get policy and say, hey, you know, can you check on this and make sure that it's inclusive of women, that the language is right. For instance, I got something the other day, and it was just a 1-pager, and it said that, you know, was about the new megabus bill, and it's with Deborah Sampson Act, and it said, you know, we'll make sure that prosthetics are available, an increase in prosthetics to women veterans. And what I said was, well, it has to be more than just an increase to women veterans. We have to make sure that they're prosthetics that are designed for women veterans, that they're prosthetics that fit women veterans, that, for instance, they're racially and culturally appropriate prosthetics. For instance, Black women don't often get wigs that are appropriate for them. They don't get wigs that are for Black women. Women oftentimes don't get limbs that are the right size or the right color for them. So what I did was I put in language that said not just an increase in prosthetics, but an increase in appropriate, racially gender specific prosthetics, because that language matters. So that's the sort of thing that we do. We also serve as an advocate for cultural transformation, making sure that the VA is a safe place for women veterans, that the level of safety is up, that sexual harassment and assault is going down, and that we're raising the awareness of the responsibility to treat women veterans with dignity and respect, and that is the same among the men who are using the VA and among the employees who are operating in the VA. And making sure that the VA is a place for all women, for women veterans, the same as it is for men. We're the portal for all things women veterans. We conduct outreach, internal advocacy, research, and performance management and accountability. And so that's really kind of in a nutshell what we do. So I've talked for years about the invisible women veteran, and this picture you see is a note, and I'm sure you've all heard about it, notes that women get on their cars when they park in veteran parking spots. I mean, this is a real thing. This actually happens. Women parking reserved veteran parking spots, and they come back to a nasty note on their car, someone accusing them of not being a veteran and they shouldn't be parking in that spot, because women are still not recognized as veterans. And then there's an organization called Service Women's Action Network that started in the 90s, and they conduct this survey every year, and they conducted a survey in 2016, and 74% of the women who responded said that the general public still did not recognize their service, even though we've been serving the military since the American Revolution. And since post 9/11, about 76% of women who've served since post 9/11 have at least one incident of combat service. So women veterans have really increased. About 10% of women veterans are about 10% of veterans are women, but about 12% of OEF, OIF veterans are women. So women veterans are increasing. And that's really important to anybody who's serving veterans. I always say people who are serving veterans, partners, anybody doing that work, they have to be prepared to increase. And this graph is really important because the veterans are
Liz, I'm not picking up any audio on this end. Is anybody else?
Madam Chair, she must have cut out since this is East Coast call.
Yeah.
Uh-oh. You lost me?
Yeah, we lost you.
I got
No, you're here. You're back again.
Okay.
Yeah, you're back again.
So did you get any of the things on the data?
The last I heard was the 12% of OIF, OEF veterans being women.
Okay, so yeah, about 12% of the population of the OEF, OIF veterans are women compared to 10% of the veteran population. So while the overall veteran population is on the decline, the women veteran population is on the incline because women are enlisting at a higher rate than men. And so while women are currently about 10% of the veteran population, it's estimated that you can see that we're increasing. By the year 2040, it's expected that we'll be about 18%, and by the year 2045, we'll be about 20% of the veteran population. So what this means to anybody who's providing services to veterans is that you need to be prepared for that increase in women veteran population. So if you're writing claims, you need to make sure that you have enough VSOs to serve women who want to deal with women VSOs. If you're providing health services, you need to have enough women providers. If you provide housing, you need to have enough housing to support women veterans, and on and on. So really being cognizant of that increase in women veterans. So you can see here how that's looking. We're currently about 15% of the U.S. active duty force, 18% of National Guard and Reserve. And so when you think about culture and race, women of color are enlisting at a higher rate than men of color. So Black women, Latina women, and Native women enlist at a higher rate than Black men, Latino men, and Native men. So that's something else to consider. So how does the VA help women? VA's healthcare, and especially during COVID, has really changed. The VA has done a great job of doing, for instance, drive-through. Because so much of the VA closed down. I'm sure a lot of you veterans are familiar with that. So they kind of led the way on, for instance, drive-through birth control. Like how do you help people, women, birth control is a monthly issue. So they changed how that looked. Telemental health was something else that they immediately shifted. And what they discovered was that women liked telemental health more than men. The rate of telemental health among male veterans increased by 1,000%. Among women veterans, it increased by 1,700%. And what we're thinking is that women, because of work, because of childcare issues, because those became a big issue, and because of safety issues, it became women took to telemental health more quickly, because that meant they didn't have to go in. They could do it from the safety of their home. So if you, as a provider, as an advocate, as veterans, if you want to use telehealth or telemental health, all you have to do, you can send a message through My Healthy Vet. I love My Healthy Vet. Or you can contact your primary care provider and let them know that you want to use telemental health or telehealth, and they can get you signed up for it. It's especially useful for rural veterans, for veterans with PTS, for veterans who have transportation issues. So please make sure you share that with the veterans that you work with, that it's very, very easy to sign up for telemental health and telehealth. So that's one of the ways that the VA is helping women veterans, especially. Aging women veterans, the male veteran population is about 15 to 20 years older than the female veteran population. So they started aging some time ago. They're 65 average compared to like 45 for women veterans. So now the VA is starting to deal more with aging women veterans. So they're starting to deal with women. Women are caregivers, but women are also starting to need caregivers. So that's something that the VA is shifting on. And also, as women age, they need more disabilities. Like I was fine until I turned into my 40s, and then I was like, "Ow, that hurts." Suddenly, that problem those knees I hurt in basic training, I needed service-connected disability and healthcare on when I was in my 40s. So as women start aging, things like military sexual trauma, injuries, etc., because the average age is 40s, those issues may be coming up now. So as claims people, you may start seeing more women coming into your offices with issues. And women's health research is something, for a long time, women's health wasn't a topic of research. A few years ago, I was at a conference, and a woman with a PTSD brain, it's like a Boston Brain Research Center. I can't remember exactly what it is, but she was talking about the brains they have on ice there. And they have a lot of them. I can't remember what the number is, a huge number. And she said she found out they had, at that time, 0 women's brains. Now, they were studying PTSD in veterans and traumatic brain injury, et cetera. And they hadn't ever bothered to get women's brains. But that's because women's health just wasn't being studied. And so we have now, the VA has, it's called the Women's Research Network. And they're actually studying women's health because they've started to realize they actually have to study women veterans and health. They have to study women veterans. For instance, one of the things that they found is that women who have been in combat, experienced military sexual assault, are more likely to get post-traumatic stress than men who have been in combat and been sexually assaulted. So there are a lot of different reasons to examine women's health separate from men's health. And so how does the center participate with women veterans? We work with VA partners, we work with community partners, and we work with women veterans. We get a lot of emails, we get Facebook messages, we get contacted through a system called Iris. We get emails from women contacted by women veterans. So they might contact us and say, I have a concern about something that happened to me at a health facility. I was sexually assaulted, or I had this incident, or I had a comp and pen exam go bad. Or one woman contacted me and said, I went to comp and pen exam and I was told to go to this address, and it was a motor home behind a hotel. Now, that's not a good idea for anybody. So we contacted the VBA Comp and Pen office and said, this is a very bad idea for all of these reasons. So we respond to concerns or issues related to harassment or assault, and we aid with questions about claims. If somebody contacts us, a woman contacted me the other day and said, I have a claim. This is what I was told by my doctor, and that doesn't sound right, and it was denied. And so I contacted the VBA person and said, here's what happened. Here's a copy of her C&P exam. And so they contacted me and they said, you're right, he never should have said that to her. And here's what we're going to do. And they reached out to her. They reached out to the C&P exam office. And so that's the sort of thing we do. Now, what we don't do is we're not cops. We don't file complaints. We're not lawyers. We run it up the chain. That's what we do. I had a woman who called me and she wanted me to go after somebody who was outside the VA. And I said, we don't do that. We stay in our lane. We take it up the chain if it's about something that we can do something about, but that's all that we do. If it's something that we can resolve, that's what we manage. So we've had family members who've contacted us and said, I had, some about burial. Like we get all kinds of, we get emails from men who've said, I'm concerned. We had an email from a guy last week who said, I'm concerned about the amount of sexual harassment that I see at this VA. And men who said, nobody will help me and I don't know who else to call, so I called you. So we say, okay, well, we'll help you too, because we don't say no to anybody. So we also work with partners. We have a national partners breakfast it's the first Wednesday of every month. People are welcome to come on and be our partner. If you serve women veterans, you're welcome to be on our meeting. It starts at 9:30 the first Wednesday of the month. We have great speakers. One month we had Cheryl Mason, who's the head of VBA claims. She came on and talked about what they're doing to clear the backlog. We've had NCA come on and talk about benefits. Like a lot of people, it's surprising to me how many people don't know about their burial benefits. We just have people come on and talk about different things. We work with VA partners and the advisory capacity I talked about earlier related to gender and racial cultural appropriateness in areas of policy, health and mental health, claims, and research. And we have our own initiatives that we do. We have a hashtag Bring Women Veterans Home to the VA. Out of the 2 million living women veterans, only about 800,000 are currently enrolled with the VA. And of those, only about 500,000 actually use the VA. So our big thing is, how do we get more women veterans to enroll with and use the VA? Because lots of studies have shown that when women veterans use the VA, they get better care. They have better mental health outcomes. The completed suicide rate is lower when women veterans with mental health conditions use the VA. And they're entitled to those benefits. They're entitled to that pay. They're entitled to all of those same benefits. So we really, really encourage women veterans to use the VA. And for instance, after COVID happened with all those layoffs, what happened was a lot of people hadn't signed up for their benefits. And then COVID happened and they were laid off from their job. And a lot of people were rushing. I'm sure you all experienced this. A lot of people who had never applied for their benefits because they had health insurance suddenly were trying to get their benefits. And there was this huge backlog that happened. So our goal is to try to get women veterans who maybe have never seen themselves as veterans to start using those benefits. Even if they never use the VA, at least get signed up for those benefits. We have a Women Veterans Summit. We haven't had it since 2019, but we're going to have one in 2022. We have the I Am Not Invisible campaign, which I actually started in Oregon. And we've had the 1.0, which we now have 3,075 pictures from every state, plus Puerto Rico and Guam. 2.0, we're having them hung in all VA facilities. Naming spaces for women veterans is something that we started. All VAs are being asked to choose one public space and name that public space for a woman veterans. And again, it's about cultural transformation. It's helping everyone recognize that women veterans, that women are veterans too, and that they've served. We have partnerships that we sign memorandums of agreement with different partners, with the Women's Military Museum, with Minority Veterans of America, with the National Association of State Women Veteran Coordinators. And we have outreach initiatives. We're doing roundtables with the tribal nations, with state women veteran coordinators, with any partner that wants to do them. We recently have done some with some representatives, and we do Facebook Live events. We formed a partnership with Tesla to help women. Women can sign on to these. If you have any women who are looking to have a resume done and get some information on how to interview, please have Kelly. Kelly knows my email address. Have them reach out to me and register for this. I think it's next week. Tesla contacted us and said it's not a hiring event. We just want to help women veterans learn how to do a better resume and get tips on how to interview so they can get jobs. That's all it is. And so if you know any women veterans who are seeking employment, who need help with resumes and interviewing, please have them reach out to me so they can. We've only got 18 women signed up for this upcoming webinar, and there's plenty of room for more. So let me know. And it's in the afternoon, so for West Coast people, it will work. So we do plenty of social media outreach. We have a Facebook page, we have a Twitter page, we have all that stuff. And we have an advisory committee on women veterans. We do site visits. I think we did one in Portland or Vancouver, like some years ago. And that advisory committee, their job, they go to different places and they check, how is this VA working for women veterans? They interview women and they ask, how is it going? What are your needs? What's not working for you? And then we hold special events. We have in the past done the baby showers, just, special events. So those are the sort of things that we do. So that's about it. Questions? That was the quick and dirty.
I have one. This is Les Trevor from Post 156. I just had a suggestion, because I know there's places that have veterans parking, but there's no way for the individual to indicate they are a veteran. So possibly something that the VA could take on is to make placards for veterans, similar to the handicap one that they could hang on their visor or something to indicate they're a veteran, especially with women being challenged. Why are you parking there?
That's a good idea. Maybe that's something the Center for Women Veterans can take on.
It wouldn't take a lot, not a heavy expense, but I just thought it'd be a good idea.
That's a good idea. I like that. Thank you.
You're welcome.
It could be one of the little swag things we hand out.
Sure.
Way to go, Les.
Well, I'm thinking.
That I did to my outreach manager.
So, Liz, I had a question. So recently, I experienced. I've had my primary care physician since I entered the VA in like 2014. It took over. It took almost 2 years to get my disability when I was in the backlog back then in 2012. So a couple of weeks ago, they just sent a letter out saying, "Hey, we're switching your primary to this doctor instead." No notice, no questions, no surveys, no nothing. And then a couple of weeks later, they followed up with, "Oh, sorry, we didn't mean to do that. What you can choose to keep your, the one you have, or go with the new one, or whatever." And then we had to go into My Healthy Vet, and we had to send, contact somebody and let them know whether we wanted to change or, stay with the same one. And now my understanding is, they didn't really poll the VA staff either. So, I understand they're trying to direct women to more women specific doctors. But again, not all of us need or want that. So it would have been nice to have been notified. I don't know if this was just Portland or if this was an initiative across, all of the VAs or whatever, but Portland did that. So I'm just wondering, I mean, I don't know. I mean, if that was just Portland, then maybe that's just Portland's leadership dropped the ball on that or whatever. But was that something that came out of some survey or meeting that needed to be done from the VA standpoint?
That's a good question, Kelly. And I think that's something, and this is something that I used to talk about a lot when I was in Oregon. Stop making assumptions. Stop assuming for people. Like ask people what they want. Ask women if they want to have a woman provider. And I've said that even since I came here. There was a question that came up. We were talking about military sexual trauma, and their solution was, well, we have to know what their number is or their email so we can contact them. And I said, no, that's not the solution. The solution is we give them the information and tell them how to contact us if they want to be contacted. And so I think that's maybe something that happened everywhere. I don't know, but I can certainly find out. If that's something that all VAs were doing, I don't need a pencil, or if that's something that just Portland did, but I will definitely find out about that. And I'll talk to Patty Hayes. She's the director at the Center for Women's, the Office of Women's Health. Once you get with your primary care provider and you like that provider, you don't necessarily want someone to just switch you without your permission.
Right. I mean, I opted to stay with mine. So my understanding is that one of the staff members who is a female veteran went to leadership and said, "I think this is really bad." I mean, I get my health care here too, and I got one of these letters and I'm a staff member and I didn't even know about this. So, I mean, I think it was just the intent was well-meaning, but I just think it was executed kind of poorly, and we know how that works. And so I'm not knocking it or anything. I mean, at least they corrected the mistake and came back and gave us the option. But I just know that, then I had to go in and send an email and, get that worked out. And it still shows the new provider they assigned to me in the system. When I went and got my COVID shot, I actually got my shot from that doctor's LPN. And so she said, "Oh, you're with, this doctor." And I said, "No, I opted to keep my original primary. So now I don't know, I'm going to have to contact them again." So, if any other women veterans are out there and went through this and wanted to keep their provider and they went through My Healthy Vet and sent a notice or whatever, they need to check to make sure that change got made. So otherwise, their appointments will be with a new provider that they're not familiar with.
Okay, good. Thank you for telling me that. I will make sure I let Patty know that it's something that they need to address.
Yeah. And so my next say is I sometimes deal with older women veterans, and when I say older, I mean I'm about to turn 57. So, but those who serve, I came in late 86. So those who came before me and blazed trails, some of them during the Vietnam era, and most of them in the 70s, and they seem to really struggle. And by struggle, I mean their perception of the VA, how they're treated at the VA, how they're talked to at the VA. And sometimes, I have a hard time connecting with them on that because I'm not treated that way at the VA. So it's, sometimes I'm like, if you walk in by yourself, why are they going to ask you if you're the spouse if there's no male veteran standing around you? I mean, again, making assumptions. But it's been hard for me to kind of, continue speaking positively about VA healthcare and getting them to go because they can't get past the information desk or the front counter or whatever. And so, just some guidance on maybe how to talk to those women and how to, make them see differently or advocate for themselves or somebody they could, go to or talk to or whatever. I mean, sometimes I'm at a loss as to how I should advise them or assist them.
And that's and that's going to be tough because it's at their age. I think it's difficult for them to speak up like that. But I think the thing to say is to just have them hold up their veteran ID card and say, no, I'm the veteran. And I think that's really and also maybe offer to go with them if you can, or have them go to the patient advocate office. Have at the ready the information on the patient advocate office so they can go in there and complain. Give them my email address. Have them contact me because that's something that we're working on. We just, in fact, had that's one of the issues that we've been talking about. And with this administration, with Secretary McDonough is really intent on changing this. I have high hopes for Secretary McDonough. He is very, very intent on changing the culture of the VA, recognizing that women have been dealing with this for a long time. We just have had a lot of meetings, and I'm on a new task force. And this is a topic that's come up over and the fact that women have to deal with this repeatedly. That I went into the Portland VA maybe 2 years ago, and I was at the prescription window holding my card up there, and the young man sitting there said, "Is this for your husband?" And so, me, I slammed my card against the window and said, "Dude, look at my card. What is wrong with you?" And so and I have told that story since I started here, but there are a lot of women veterans who work here who've told similar stories, and we just keep telling people over and over again, this has got to change. But they're starting to talk about a lot of different training modules that are going to be mandatory for employees, where it's completely unacceptable. One of the things that I said the other day is we have to remove pronouns. We have to remove all pronouns from letters. I saw a letter the other day, a claims letter that said him, his, and it was to a woman. And I said, this is completely unacceptable. We have to remove all pronouns when they go out and call on someone. If they don't know whether it's a woman veteran or a man veteran that they're about to announce, they shouldn't be saying Mr. or Mrs. They should say patient Jones or veteran Jones. They have got to stop this business where they are always calling people Mr. or asking about the husband. Or what I say is just assume if there's a woman in the VA, assume she's a veteran. Period. End of story. And if she's not, she'll tell you, no, I'm a spouse, because it is such a problem. So it's something, just, back to your question, just say to the women, ma'am, I know it's difficult for you because that's not the way you were raised, But if that, have your card in your hand, and if somebody says that to you, show them your card and say, young man, young woman, I served in the United States military. I'm the veteran. Show some respect. Teach them, help them practice a line that they can feel comfortable saying, or even if it's just holding up the card and saying, I'm the veteran. And maybe that will help them get used to being able to take that on when they go to the front desk, or take the initiative. So when they walk up to the front desk, they have their card and just hand it to them and say, I am here for an appointment.
That sounds good. Anybody else have any questions?
I do. I don't know if it's anything you can help me with, Elizabeth, but I would be interested to know if anybody else has come across this issue. 4 years ago, I applied for my VA benefits through a hardship. I lost my job and I didn't have any insurance. And so I went to the VA and presented them with the information that they asked for, and was given that hardship. So I was able to get VA medical through Portland. I received a letter a couple of months ago that has stated, oh, we made a mistake. It's unfortunate, but you no longer can get your VA benefits. So I'm like, what?
Yeah, that doesn't sound right.
I don't understand what happened there, but I mean, do you know of any recourse concerning something like this?
Well, and that's not, especially during COVID. I just saw something recently that said that that they're not supposed to be taking those kind of benefits away. I thought, again, Kelly's got my contact information. So make sure Kelly and Sam both have my contact information. So make sure you get that so you can send me an email. But because that hardship is income based, and
Right.
they shouldn't be taking that away from you.
Well, I mean, in a letter they said that they made a mistake about my income, but my income was plainly there. I mean, it was lower than what, you know, the level was. But all that to say, I'm no longer in that category, and I no longer need that hardship insurance through the VA. But because I have a Medicare Advantage plan now. But if something happens, if I'm traveling somewhere or whatever, I mean, it would be nice to be able to go to the VA.
Yeah.
That's all I
And
have to say.
well, but I don't think they can't. The thing is, they can't make you pay that back. That's the thing that was just passed, is that anybody that owes them money for whatever reason, they just passed a thing where they can't make people pay that back, is what I'm saying. So if they start trying to pursue that, contact me and let me know, because there was something that was recently passed. I can send that to Kelly too, Kelly and Samantha, so that they have it, because my understanding is they're not allowed to do that now. It was recently passed.
Good to know. Thank you.
You're welcome.
My name is Gene Kuchar. I'm from Post 14. And if you get that, please email me that information.
I will just get it and email it to Kelly and Sam, and then they can email it out to the whole group.
Right. Thank you.
You're welcome.
Okay, Shannon, you should have an email from me.
Thank you, Kelly.
You're welcome. Anybody else have questions? Tanya, you got a question? Yay.
And again, I'm not sure if this is something Elizabeth and her group can handle, but I also find being a veteran at the VA can be difficult, and being a single veteran can be very difficult. I went to go have a surgery on my hand. First they tried to tell me I had to have somebody come with me and stay with me the whole time and drive me. I said, no, my friends work. You know, I don't have anybody, have to ask a friend to take a whole day off work. I know you guys have transportation. And so I had to go to the transportation office. I set everything up. My good friend Bruce dropped me off at the hospital that morning. but the whole day, where's your spouse? You know, where's your husband? I'm like, I don't have a husband. I'm by myself. Well, we can't do this. Yes, you're doing the surgery. Yeah, I mean, this is always a thing. So, yeah, number one, always assuming, where's my husband? I'm like, no, you know, I'm here by myself. I'm single, and I've already arranged my ride home, and they're just having a fit. I'm like, I told the lady, I was like, not everybody has some spouse to follow them around all day, you know. Some of us are still young enough that we work, and all of our friends work. You know, it's like, come on.
Yeah, it's funny you should mention that. That was something that we brought up in the presentation I gave last week when we were talking about equity. We were talking about the things women have to hear, and that was actually something that, because I'm single, that was actually something that I said was that women have to hear that a lot. So, others?
I have a quick question. This is Mallory. I'm the Disabled Veterans Case Manager at Workforce Vancouver. I was listening to the conversation where you were talking about like a web event for women veterans who are looking for work. Is it possible to get a little bit more information on that? I do send out a list of resources every day, and I can get that out tomorrow to a lot of veterans.
Sure. Kelly, would you just send my email out to the group, please?
Yeah, myself or Sam
We
can do
all
that
have-
after them. Yeah,
Okay.
unless you want to
that would
put it
be
in the
great.
chat.
And then you, oh,
I mean, I guess I can put it there too, but you know.
oh, there it is. It's the chat. Here.
And I usually do a follow-up email after the meeting with a slideshow presentation, and I can include that information to all the members, so that anybody that missed the meeting will also be able to get that.
That would be helpful, yes.
Okay, are there any other questions? Liz, are you still with us? No, I'm seeing low bandwidth notice on her thing. Can you hear us, Liz?
Uh-oh.
No.
Uh-oh. Are you there?
Oh, there she is. Yeah, you're back. All right. In the meantime, everyone, Liz has put her email address in the chat, and then Sam will do her usual follow-up after the meeting to disseminate any information that everybody in the group needs to have. So it looks like Liz is falling off here. Again, she's on the East Coast, and there just might be issues. Who knows? So I think, did everybody get their questions answered? If not, you have her email, contact her with whatever questions or concerns you have, or even, as Les did, with possible solutions to some of the things that we've discussed or other issues that you're aware of that women veterans deal with when utilizing the VA. Oh, she's back. You keep popping in and out.
Yeah, I'm here. I'm not. My condo's not for Quantico, and when they have problems, I have problems for some reason. So
okay. Well, I think we're done. If you want to go have a dinner or something after your all-day job.
All right. Well, thank you, everyone.
We don't want to keep you. Really appreciate you doing this.
It was great.
It's good info.
Thank you.
Thanks.
Bye.
Bye. All righty. So Sam is bringing back up the agenda, I would assume. Takes a little bit. Go.
Can you see it?
I can see Liz's thing is still up, yeah. So, I mean, I think what's up next is the reports and stuff, right?
Yes, I don't know why this always freezes when it goes to the next.
Madam Chair,
to
the
be-
next item on the agenda is our WDVA County Service Officer update.
Yeah, we're not going to talk about that today, Bruce.
Okay.
We're going to push that to next month. So,
Okay, then I guess.
so it'd be. Yeah,
So actually-
appeals and policy.
yeah, the next item would be the committees and the policies and procedures and appeals. So, Mike, if you have anything on appeals, you can chime in.
Yeah, nothing on appeals this last month.
Okay, awesome. And then policies and procedures, I think we're pretty good there, Tanya, correct? We just did the last one and it was approved, so
Yeah.
no other issues? Okay. That was easy.
I would like to, maybe next meeting, not this meeting, we don't have to do it, but look into being able to help people who are staying in hotels also. But we can talk about that at the next meeting.
Okay.
But yeah, right
Sounds
now
good.
we have nothing. Okay, thanks.
Okay. So Sam, I think that's to you now for the contractor and fund reports.
My whole screen just crashed. Can we pass to the Veterans Assistance Center and then I'll get my numbers back here shortly.
Yeah, sure. Judy, are you and Sharon ready?
Absolutely. We're always ready.
Okay. All righty.
So today I want to talk to you guys about a new housing program that we just got through the county. It's partially federal and it's partially state. It's CARES money, and it's going to allow us to help any veteran who is 50% of median income who has been directly or indirectly affected by COVID. We will be able to pay up to 12 months rent. And that could be 9 months that they owe past due. It could be 12 months that they owe past due. It could be 6 months past due and 3 months in the future. It's really going to be quite a help especially for the veterans who got behind because they got laid off. Maybe they didn't get their unemployment, or maybe they did get their unemployment, but it wasn't enough to help them stay caught up. So if you know veterans that have been affected by COVID and they're behind in their rent, or they are have housing instability because of COVID, send them our way.
And this is for people, all veterans with, it doesn't matter their discharge status.
Exactly. Yep.
Judy, would
Yeah.
that include mortgage and rent?
No mortgage. No, only rent. Yeah, only rent.
Why is that? Why is
That's the way the feds and the state set it up.
I'm
I
a
mean,
new here. Would I send it to you if I had a vet?
Sorry.
My name is Gene Kuchar from Post 14.
Hi.
Hi, I'm a newbie to this meeting.
Okay.
If I have a vet in these circumstances, who would I have them contact?
Have them call the Veterans Assistance Center, and I can give you that number.
Okay.
We'll put it in the chat, okay? We'll put the number in the chat so you can pick it up.
Okay, I'm also so new I don't see the chat.
Okay.
I was going to say, I'll also include it in the follow-up email, just so everybody has it just at their fingertips with all the information.
Fantastic.
So anyway, if you know any vets that are having difficulty catching up with their rent, or, you know, maybe they have difficulty for any reason with their rent. If it's directly or indirectly related to COVID, then we can help them as long as they're under 50% of median income. And 50% of median income for one person is $32,250 a year. That's 50%. So the next thing that we want to talk about is, you see on your screen that we are in the middle of an online auction. That auction has 2 more days. It's going to be over on the 10th, and there's some great items on there. There's a fishing trip, there's a Leavenworth trip, there's a Bend, Oregon trip, there's a parachute jump, there is quite a few baskets, there's some golf, something for everybody. So go onto our website and click on that auction link and bid on something, because we've been seeing quite a bit of activity, and since we didn't get to do a fundraiser this year, this is how we're trying to raise some funds for the center. And the next thing that go ahead. So I just wanted to say that the next thing is the Operation Home Rescue that I spoke to you about last month is up and running. So if you have veterans that are 55 or older and they own their home, and they're at 80% of median family income, tell them to call us and tell us that they want to apply for Operation Home Rescue, because TMG Cares is they're having their nonprofit division do some repair work. Also, like any structural work, like for a disability, if they needed a ramp or something like that, they could assist with that. So the application is on our website, or you can call our office and someone will send you the application. So we have lots of stuff going on. We actually are working now until 3 p.m. instead of 1, trying to get this new program off the ground. So we're excited about it. We think it's going to help a lot of veterans, and yeah, that's what's going on.
Okay, thanks. Anybody have any questions for Sharon or Judy? I keep getting outbid, so I just quit bidding.
Oh no, don't do that.
Well, I have a threshold because I have bills to pay. So it's like, I was like, I don't know that. Yeah. So, I mean, I don't know. I might go in again. Maybe. I mean, I pushed a few things up in cost, so I did my part. I might take a look at it again, but.
All right. Raise those bids, Kelly.
Anybody else? And before you, and so when you, in order to place a bid, you need to create an account. It's not like you got to put a credit card in or anything in there, but you know, it's kind of like a silent bidding thing. So you need to create the account, and then when you go in, it'll, you know, automatically track all your bids for you, and it'll notify you if somebody outbids you, so on and so forth. So it's pretty handy. It's super easy to use, so not difficult at all. And when I first looked at it a while ago, you guys have added a lot of really great things, like the trips and the boat and all that kind of stuff. So there's some really cool stuff on there that's great for families. So I encourage, send it out to all your friends. I put it out on Facebook, so send it out and tell people to go get some.
Yes, it's also on our Facebook page.
I have one last question for you. It's not about the auction. Do you remember me calling you a couple of months ago about that veteran, legless veteran that was in the wheelchair?
I do.
And the sign?
Yes.
Did you ever find him?
We did not. We sent someone down there, and I notified the local homeless police chief that handles all the homeless people on the street. And so that's Tyler Chavez. And so we notified him to be on the lookout for the gentleman, and he said he would, and he would have his crew look. So we have not heard anything further.
Okay. All right. Well, thank you for trying.
Of course.
Was it, Shannon, was this downtown Vancouver?
Downtown in front of the cinema. He was sitting there in the meeting
Yeah.
in his chair.
He's a Marine veteran.
Yeah.
Yeah, I've seen him. I've seen him at the warming shelters, and I've seen him at the food bank. So it's his black wheelchair. He's usually got his ruck or whatever on the back, and he usually always has his veteran hat on, and he does have a sign. But he's been in this situation. Judy, I think you guys know him.
Yeah.
I think when you figure out who we're talking about, you'll realize that you know him, because I know he's been into the center.
Okay.
So
And I've talked to him. I gave him our card, stuff like that too. So yeah, he's been approached.
yeah.
He says he can't get any help from the VA. I don't know how true that is, but maybe next time you run across him, you can actually question him more closely.
You know, we have people all the time who say they can't get help from us either. And usually it's because they don't ask for the help. They don't want the help we're trying to give them, or they can't give us any kind of documentation to allow us to help them.
I know.
So, I mean,
people have all kinds of reasons, but sometimes just sitting down and talking with them and really finding out what's going on will help them. But I know that you guys do that too.
yeah, I even set markers down there.
Okay. Any other questions for the center? If not, then we'll go back to Sam. If Sam, are you ready?
Sorry, I have some kind of issue every single month, but the numbers should be up there now. The Veterans Assistance Center served 22 veterans with different types of services in February, total of $14,726. You do have the detailed reports in your email. They saw 21 men, 2 women veterans. There were a total of 126 visits to the center for essentials and food boxes. 110 meals were served. And they had 254 volunteer hours worth about $6,284 in volunteer time. The free clinic dental program saw 2 veterans. They both got some exams, some x-rays, and some extractions. They reported that the value of this care was $198, which seems really low to me, and I should have asked them about that. They billed us $681 for the care. And we received $33,854 in revenue into the Veterans Assistance Fund in February. We had expenses of $51,299, and the balance of the fund at the end of the month was $709,814. This month is a property tax month, so we'll be expecting to see our first half fund deposit here shortly, and we have a healthy balance. Any questions?
Anyone? Whoever that was, go ahead.
Oh, I just said, yay, us. It's Gene Kuchar again.
Oh, okay. Gotcha. All right. Any old business? I don't think we have anything hanging out there that I'm aware of. New business from anyone?
Well, I'll just mention I emailed out to board members on a public disclosure request that we received, and I was surprised and I felt horrible that I've never talked to the board about public disclosure responsibilities, and that it wasn't even clear to us when we got this request if the board was subject to this. So we found out that yes, they are, and I'm going to try and pull together other information about county code or board member responsibilities or board member, I don't know, I was going to say liabilities, but just like other things to be aware of that I have never updated the board on. So I think there's going to be some information about open public meetings and conflict of interest. So just like some of that administrative stuff that I have never brought up, and I'm going to start providing it like every January, just as a reminder to everyone, but I'll try to see what I can find and collect the information, and then hopefully provide it at the next month's meeting. And we'll just kind of go over all of the different county code or whatever for board members. So I'm sorry about that if you guys were surprised to get that email, but we're working on getting that resolved, and Thank you. If you have anything, please send it to me.
There is one clarification I do want to bring to the board's attention, Samantha, and that is I am on an infrequent basis talking with Erin Nolan because I've known her for a long time in our community. But I just want to let everybody in the board know that at no point do I ever discuss directly with our county service officer about a veterans issue, being a board member, because for one thing, it is not my place. But I just want to let everybody know that I might infrequently, touch base with Erin. That's totally outside of the realm of her work, just as kind of old friends from the past. So I just wanted to get that disclaimer out.
Thanks, Bruce.
Thanks, Bruce. So Sam, my question would be is should this information be in the bylaws of the board as well? Like kind of a lot of nonprofits put that in their bylaws. So, because that's the first thing I read when I joined. So there's nothing in our bylaws to that effect. So it might be helpful as new members join or, the current members that are here now, at least they'll have kind of what the responsibilities are and, so on and so forth. So, because I just think that might make sense, but it's just a suggestion.
All right, that's a great suggestion. That absolutely is a good place to put it. That they're not all in different documents. You'll have one thing that governs all of the board business as well as all the county requirements, and it'll be in the bylaws. Let's do that.
Yeah, sounds good. All right, are we at open forum now or possibly? So I'll just go ahead and I'll kick it off. If everybody's not aware, I'm pretty sure maybe you're all on VA mailing lists or whatever, but the VA is open to all veterans, regardless of their eligibility, their spouses and caregivers. So if people want to get the vaccine, I highly encourage them to, get that information and contact the VA and go get their shot if they want to. I understand they're having a big vaccination event in Longview, I believe, coming up. So, Sam, do you get the messages from Dan at the VA about stuff like that?
Yes, I do. Do you want me to send out? That was at Mark Morris High School.
Yes. Okay, great. And it's coming up like next weekend or something, or?
Yeah, I'll send that out.
I think. Yeah. Okay, that would probably be good, just if folks want to send that out through their posts or whatever. So otherwise, that's all I have for anything that I know about. Does anybody else have anything they'd like to share or discuss? Is that a no?
It's a no for me.
All right. Do we have a motion to adjourn then?
I'll shoot your motion to adjourn.
All right. Second? Can I get a second?
Second.
All in favor, right? Except for Michael Harding, who is not here today. So I have to go on record for him saying that he doesn't want to go. He's in San Jose having fun, and we're all going to go. All right. So unless there's anything else, we're adjourned. Everybody have a great rest of your afternoon. Next meeting is May 13th. So thanks for everybody for coming. Welcome, Gene, from post, was it 14?
Yeah.
Okay, welcome to the conversation here. Hope we see you again. And of course, if anybody has anything throughout the week or the month or whatever, you've got all of our contact info. So everybody take care and have a great day.
Bye, everybody.
All right. Bye.
Yes.
Goodbye.